Dear students, we are starting a new chapter, the wrist and the hand complex in biomechanics. In introduction, the human hand may well surpass all body parts except the brain as a topic of universal interest. The human hand has been characterized as a symbol of power, as an extension of intellect, and as a seat of the will. So basically, we can say that the human hand is a highly complex part of the body, and intellectually and as you see now how the reason for civilization, it can be first understood as a part of a higher functioning brain which human beings have. Second reason would be that we have hand. Everything on this planet made by man, or what we can call it as made by civilization, is basically made by hand. Even though the brain is the intellect behind, but the hand is a tool which helps the man to achieve whatever his will is, whatever his desire is. The symbiotic relation of the mind and hand is, so there is a symbiotic relation of the mind and the hand, is exemplified by sociologists' claim that the brain is responsible for the design of civilization, but the hand is responsible for its formation. The hand cannot function without the brain to control it. Likewise, the encapsulated brain needs the hand as a primary tool of expression. The entire upper limb is subservient to the hand. Just imagine if a person has a below elbow amputation. That means his wrist and hand complex is gone. It's not there. So with that, actually 80% or 90% of the upper limb functions are lost. The rest of the upper limb is of not so functionally useful. So without the hand, the upper limb is of no use. Any loss of function in the upper limb, regardless of the segment, ultimately translates into diminished function of its most distal joints. It is the significance of this potential loss that has led to detailed study of the finely balanced intricacies of the normal upper limb and hand. So, because of the importance which we have already stated, scientists and the medical research fellows have already mostly tried to understand the finely balanced intricacies of the normally functioning upper limb and hand. Now coming to, before going to the hand, we have to first understand the wrist complex. So basically the wrist or the what we call as the carpus consists of two compound joints, the radiocarpal and the midcarpal joints, referred to collectively as the wrist complex. So we have carpal bones. Here we have a drawn figure, and here we have a radiological view of the carpal bones. The wrist complex as to the whole. Here you can see this is the radial radius and the distal end of the radius. You have ulna here, and you have the scaphoid, lunate, tricutal, and pisiform. This is the lateral side of the hand, and you can see that the radius is there, and this is the scaphoid, and then you have the lunate, tricutal, and pisiform. This is the lateral side. This is the middle side. You have, because you have the ulna on the middle side, and the pisiform bone. It actually is. You can see the triangular the cartilage, the articular disc. You can see here, and then you can see all the soft tissue structures around the ulnar area. That is ulnar collateral ligament and the meniscus homologous, and the structures of the soft tissue which is covering the pisiform bone. So here also you can see the radius in the radiological view, the ulna, the pisiform, tracheotoral, lunate, and scaphoid. Then you can see the trapezium, trapezoid, capitate, and hamate. So these are the proximal row of bones. The proximal carpal bones are the scaphoid, lunate, tracheotoral, and pisiform, and the distal row of four. So altogether we have 8 carpal bones, in which the proximal 4 are scaphoid, lunate, tracheotoral, and pisiform, and the distal are trapezium, trapezoid, capitate, and hamate. And then you have the metacarpal bones, which are numbered according from the laterally 1, 2, 3, 4, and 5. Metacarpal 1, 2, 3, 4, 5 metacarpal bones. So dear students, try to draw this figure and try to understand this, because in future you are going to see, whenever you see a patient with wrist and hand injuries or any kind of fracture or anything, so for to understand the biomechanics and later on to administer or apply good physiotherapy, you require a good knowledge, anatomical as well as biomechanical knowledge. But basically, to have a good biomechanical idea, you need a thorough anatomical knowledge. So this is the the anatomy of the carpus or the wrist complex. Each joint proximal to the wrist complex serves to broaden the placement of the hand in space and to increase the degrees of freedom available to the hand. So in each and every, you have a lot of different carpal bones. 8 carpal bones are there. So that makes the joint too much complex. Lots and lots of minor joints. You have the radiocarpal joints, which is in the proximal. Then you have the midcarpal. Then you have the carpo metacarpal joints. So all this together will make lot and number of joints. So the idea of the increased number of joint is to serve to broaden the placement of hand. The idea is to broaden, or improve the placement of hand in space and to increase the degrees of freedom available to. So it is basically to increase the placement of hand in whichever area we require our hand to be, and increase the degree of freedom available to the hand. That is a reason why we have these many complex and small carpal bones, variety of bones, 8 bones, and many number of radiocarpal, midcarpal, and carpometacarpal joints, which are very much essential for the increase, broaden the placement of hand space and to increase the freedom of the hand. The shoulder serves as a dynamic base of support. The elbows allow the hand to approach or extend away from the body. We have already studied that. And the forearm adjusts the approach of the hand to an object by supination and pronation. The carpus, unlike the proximal joints, serves placement of the hand in space onto a minor degree. The minor the degree. The major contribution of the wrist The major contribution of the wrist complex seems to be to control length-tension relationship in the multi-articular hand muscles and to allow fine adjustment of grip. The wrist muscles appear to be designed for balance and control rather than for maximizing torque production. The adjustments in the length-tension relationship of the extrinsic hand muscles that occur at the wrist cannot be replaced by compensatory movements of shoulder, elbow, or forearm. That is a radioulnar joint. The wrist has been called the most complex joint of the body from both an anatomic and physiological perspective. The wrist complex as a whole is considered to be biaxial. The wrist complex together is considered to be a biaxial joint with motions of extension bar flexion around a coronal axis and ulnar deviation bar radial deviation around an anterior posterior axis. Most argue that some degree of pronation and supination may also be found, especially at the radiocarpal joints. The ranges of motions of entire complex are variable and reflect the differences in carpal kinematics that arise from such factors as ligamentous laxity, shape of articular surfaces, and constraining effects of the muscles. Normal ranges, as cited by many studies, are 60 to 85 degrees of flexion, 60 to 85 degrees of extension, almost similar flexion extension. You try with your hand and see, you will get almost when you move your hand up and down. That is a extension. When you move it up from the forearm down is called as flexion. So the normal ranges are between 65 to 85 degrees of flexion. Almost you won't get a 90 degree. If you try, you'll see that just lacking some few degrees to reach 90 degree. But you will feel that in extension you are getting somewhat more than the flexion. And 15 to 21 degrees of radial deviation, or otherwise called as radial, the lateral deviation of the wrist, and 25 to then the medial deviation is comparatively larger, because that is because of the reason for that, the biomechanical reason for increased ulnar deviation will be discussed later on. The ranges are contributed in various proportions by the compound radiocarpal and midcarpal joints. Guilford and colleagues proposed that the two-joint rather than single-joint system of the wrist complex permitted large range of motions with less exposed articular surface and tighter joint capsules. That is the reason for, and proposed by Guilford and colleague, that two joint rather than single joint system. How do they, even though they are two joint multi joint muscle, but multi joint, but they work as a single joint system. You can't say single joint system they are working as. And that, because of that, what happens, it can, the wrist can permit large range of motions with less exposed articular surfaces and tighter joint capsules, has less tendency for structural pinch at extremes of ranges, and allowed for flatter multi-joint surfaces that are more capable of withstanding surfaces that may come to contact. Again, now we will go to the anatomical structure of the radiocarpal joint. First, we'll be discussing about the radial carpal joint. We are not including the ulna during while discussing about the proximal wrist joint. Why? Because you can see that the ulna does not have a direct contact because of the soft tissue structures which are present. So you can see clearly here in this figure, and also in the radiological expression. Here the radius has a very close contact with the scaphoid and lunate, but the ulna is mostly attached to the radius, and it is that we have already studied in the distal radioulnar joint. And here you can see that there is no articulation between the ulna and the pisiform, and here it is evident because the articulation, you have the disc here, and the pisiform bone is overall 360 degree totally covered by soft tissue structures, even though we see pisiform bone in the articulation. So the radiocarpal joint is formed by the radius and the radial